So what is a TMJ MRI scan? A TMJ MRI is a non-invasive imaging technique that employs magnetic fields and radio waves to generate detailed images of the temporomandibular joint. The patient lies on their back. The technician tells the patient to open and close their jaw during the imaging process that takes about half an hour to complete. TMJ MRI is a huge magnet that measures water, and water has a minute electrical charge that an MRI scanner can measure. When looking at a TMJ MRI scan, any anatomic structure that has water in it will appear white or light gray, and structures with little or no water will appear very dark or black. Unlike other imaging methods, such as X-rays or CT scans, MRI produces high-resolution images without using radiation, making it a safe option for diagnosing TMJ issues. The TMJ is located immediately in front of the ear. Note that there are many anatomic structures in and around the TMJ. Note the thin disc between the bones of the mandible, that's the lower jaw, and the temporal bone, that's the socket at the base of the skull. The bones are made of dense, hard minerals, and the disc is soft and should move with the mandibular condyle as the jaw opens and closes. A TMJ MRI scan shows excellent detail of all structures within and around the TMJ. It is a movie that is made from the TMJ MRI that reveals the structures as well as how they move during jaw opening and closing. This is the screen for viewing a TMJ MRI. On the top are a series of different images that were made in great detail. We can click on these and bring these down to look at them. This is a right temporomandibular joint, as if we're looking straight on at the face. This is the right cheek. This is the base of the skull with brain up top. This is a very arthritic mandibular condyle and a laterally dislocated disc. If we want to see this in a different dimension, we can take a side view. And here we can see the ear canal, where the pointer is, and as we take a slice inward, we can see the mandibular condyle with a dislocated disc. We can even use the TMJ MRI to make a movie of jaw movements. So this is the left side, and it shows that there's limited opening because the disc obstructs jaw opening. And if we click through it a little bit more, we can see the right side, which very well shows an abnormal arthritic condyle, a dislocated disc, and bone-on-bone contact, which is highly suggestive of a perforation of the retrodiscal tissues in the joint. In all of the anatomic structures we can see with a TMJ MRI scan, we can see bones such as the mandibular condyle and the temporal bone that contains the socket part of the TMJ, the ear canal, and the dense bone behind the ear called the mastoid process. Importantly, we can also see the TMJ disc, ligaments, and muscles too. Here's an example of an abnormal TMJ. The disc of the TMJ is dislocated because the ligament tissues were very stretched and torn. The deformed disc then blocks or obstructs the movement of the condyle. TMJ pops because the dislocated disc is dislocated when the jaw is closed, but then pops back into the mandibular condyle when the jaw opens. TMJs are three-dimensional structures, and there may be a variety of clicks and pops as the disc rotates and rolls around while the jaw moves. Viewing the TMJ MRI from the front is called a coronal view. These images reveal the discs are displaced to the outside surfaces of the condyles. This indicates that there has been severe stretching and tearing of the TMJ ligaments that cause the disc to go to the outside of the TMJ. When someone has TMJ symptoms, such as jaw pain and headaches, TMJ noises, and difficulty opening or moving their jaw, the TMJ MRI provides the best diagnostic information about the TMJ. However, TMJ MRI scans are expensive and are only one important part of evaluating TMJ anatomy and function. I order a TMJ MRI scan for my patients when I suspect that they have a serious TMJ disorder.